Hello, everyone. It's my honor to present our work, OralViewer, the 3D demonstration of dental surgeries for patient education. So patient education is very important in dental clinics. And one of the reasons is the dental fear. The dental fear is defined as an irrational and uncontrollable feeling for incoming dental treatment or surgery. And it is very common among general population. And one of the root reasons for dental fear is the fear of unknown things. And because of that, efficient patient education that unveils the treatment process is a key method to relieve such kind of fear. And in the current practice, dentists mostly rely on verbal descriptions for the education. However, it can be inefficient because dental surgeries can be very complex, and there is a high knowledge barrier between the dentist and the patient. So in this work, we propose a totally different way to do the education. So to inform the requirement of an ideal education tool, we perform a formative study with dentists, and here are what we learned. So first, the dental tool should be based on a patient-specific 3D dental model. So for one thing, the 3D model is more intuitive and complete than the 2D ones. And for the other thing, the patient-specific model can better explain why a certain step is carried out or not. For example, there are multiple ways to do one-tooth extraction, and the decision is made mainly based on the dental condition of a certain patient. And second, the 3D model should be generated from 2D X-ray rather than from 3D imaging, for example, CT. This is because the 3D screening is not a standard practice in dental clinics with its high radiation and a high cost. But on the contrary, the 2D X-ray is mostly required for all the dental surgeries or treatment. And third, the complete oral cavity model should be provided, which can include the tooth, the jawbones, and the periodontal tissues. All of those components are important to let the patient fully understand what to expect in a surgery. And lastly, the tool should be able to animate the models during the demonstration, and should also be easy to carry out by dentists with simple interactions. So informed with those kind of requirements, we developed the OralViewer. So here is the demonstration of the tool based on a real dental patient case. So the patient here has a fractured tooth, and the surgery repaired the tooth by installing an artifact crown upon it. So know that the whole software is a web-based application, and all the operations can be done on the dentist laptop using the mouse as a very easy input device. So overall speaking, the tool is consist of two cascaded parts. One is the 3D reconstruction of oral cavity from 2D imaging, and the second one is the demonstration interface with multiple virtual dental instruments. So regarding the 3D reconstruction, there have been multiple studies doing very fancy reconstructions. But there are two challenges that make our task to be unique. One is that most of the existing methods are dealing with the reconstruction of a single unified object. But in our task, there are multiple objects. And a second, the X-ray imaging is of much higher resolution than the regular RGB photos, which can be a challenge for the computation. So we propose the very first deep learning model to deal with the task. And I will pass the details, but the main idea here is to solve the challenge of reconstructing a whole or activity model into two subtasks. The first task is teeth localization, and the second one is the single tooth reconstruction from a local patch. And moreover, the dental arc curve information is totally lost from the screening process of X-ray. And to recover, to pick up those information, two photos of a patient, one for upper jaw and the other for lower jaw, is collected by dentist. And we have developed an active counter-based method to do the curve estimation without any supervised training. So with the prediction of the dental teeth localization and the single tooth reconstruction and the dental curve information, we can finally reconstruct the full teeth structure. And also, we need to reconstruct the jawbone and the periodontal tissues. So basically, we built a template model for them by extracting from existing 3D imagings. The reason is that those structures cannot be well reflected in X-ray imaging. And for any incoming patient, we register the models to the estimated arc curve and correspondingly deform them, and then assemble them together with the reconstructed teeth for the final complete oral cavity model. So regarding the demonstration interface, we allowed the dentist to import a reconstruction model and freely rotate and scale the model for demonstration. And we have implemented 7 common virtual instruments, which are sufficient to demonstrate a wide variety of dental surgeries. And for each selected instrument, we visualize the tool, and also we allow the user to customize the animation effect of the tool by using the sliders. And to apply the tools, the tool can be directly applied to any of the object by using the very simple operations, including the clicking, the pressing, the dragging, and we can show the real-time effect of them. And also, since surgery can consist of like multiple steps using different surgeries, using different instruments, our tool enables the demonstration to be done incrementally by applying multiple instruments on a single 3D dental model. So we run the patient study and the expert study with 12 real patients from dental clinics and with 3 dentists doing the demonstration. So briefly speaking, we compare the patient understanding of the surgery after the patient education and between using the OralViewer and the traditional verbal-based method. And we find that our method can significantly outperform the existing ways. And we interview the 3 dentists to verify that our dental instruments are easy to use, and the demonstration effect is clinical valid for the patient education purpose. And the OralViewer is actually preferred to integrate into the existing pipeline of dentists. So to summarize, we develop and show the first 3D demonstration tool for patient education for the dental surgeries. And the tool is enabled by a novel deep learning-based model to do the 3D patient-specific and accurate reconstruction of dental structures based on only a 2D imaging, which makes this tool to be widely available for different surgeries and without adding any actual screening cost. And the tool also equipped with easy-to-use virtual instrument, which enable the tool to do the realistic and real-time demonstration of the dental surgery.